Good morning, Miss Taylor. How are you today?
Good morning. I'm doing good. How are you?
I'm good. I'm Kayla. I'm going to be your nurse today. What brought you here today?
So I'm considering having my tubes tied. I don't know much about this procedure except for what my sisters told me. I already have 9 children though, but I'm just not sure if I want to be sterile.
Okay. Well, do you mind if I sit down and talk to you a little bit more about it?
Yeah, perfect.
All right. I'm glad you came in today to answer any of your questions or answer any concerns that you have. First off, tell me a little bit more about what you know about tubal ligation.
Okay, so I know that this is like a permanent type of birth control, meaning like it'll make me sterile. My sister had her tubes tied after her C-section, but she told me that if I did decide to do this, then reversing the procedure is like a major surgery and it's not usually effective.
All right, so that is correct. Can I start by telling you a little more about tubal ligation, and then we can discuss some of the benefits and the risks of the procedure?
Yeah, sounds good.
So, basically during tubal ligation, the fallopian tubes are either cut, tied, or they can also be burnt or blocked, and it permanently prevents your pregnancy. So, the best time to do the procedure is shortly after childbirth, or in combination with another abdominal surgery, like a C-section. So, for tubal ligation, it does not use hormones to prevent your pregnancy, so it will not cause menopause, it won't change your periods, or alter any other of your hormones. And it does not protect against the sexually transmitted infections. And as you previously mentioned, it's not successfully reversed. So this would most definitely be permanent.
Okay. So how would the procedure be performed if I'm not like having an upcoming abdominal surgery or childbirth?
So it can be performed anytime. It's an outpatient procedure. They would use a laparoscope and some short-acting general anesthesia. So it's a laparoscopic surgery. So they would insert small incisions on your abdomen. They would blow your stomach up with air to be able to see a little bit better the fallopian tubes, so they can really get in there and know what they're looking at. And that would pretty much, after the surgery, it would just be little while in the PACU, just to make sure you're stable and ready to go home. So you would go home the same day.
Oh, okay. So do you know what the effectiveness of this procedure is?
So the rates for pregnancy after the ligation are 1% in women over 34, and you are 35. So the odds are pretty high of being successful. So it's effective immediately since it's a surgical procedure.
Mm-hmm.
There are other non-surgical sterilization procedures, and it involves devices that are inserted into through the vagina and uterus into your fallopian tubes, and the placement does not require an incision, but these are not as effective and they're not effective immediately.
Okay. Do you know if this is covered by my insurance?
So most insurance does cover the procedure. We can check and see when you check out today what insurance you're under and find out if they will cover the procedure. So for patients covered by insurance, the typical out-of-pocket cost would be just a copay from about $10 to $50, just depends on your insurance, and then possibly a co-insurance of 10 to 30%.
Okay, it's not too bad. What side effects should I be aware of, like after the procedure's over?
So I do have a handout that will list some side effects. Let me go over here and find it. Somewhere in here. Here we go. Alright, so here is the pamphlet that I have for you. So some of the major side effects include abdominal pain or cramping, some dizziness, fatigue, gassiness or bloating, and that's just from the air that they insert to kind of blow your stomach up. That has to be released somehow. There is some shoulder pain at some times and discomfort at the incision site, just from the healing process.
Gotcha. So speaking of that, what risks are there that will affect my body from undergoing like this type of invasive surgery?
So since it's an abdominal procedure, there's always a risk for damage to the other organs that are located in the same central region. So for example, like damage to the bowels or to the bladder. And there are some major blood vessels that are in that area, so there could always be a risk of nicking one of those. This procedure also requires anesthesia, so you may have a reaction to the anesthesia. That's not always common, but
Right.
it's
And I've
there's
had a
always that
procedure
risk.
before the anesthesia. And none of
Okay,
that happened.
that's good to know. I can put that in your chart.
Okay.
The incisions made in your abdomen. Also, you always have risk for infection if you're being cut open in any way, because that's just a new site for infections to get in that we don't normally have.
Yeah.
So there may be some improper wound healing just from maybe an infection or just not the skin wanting to heal right. And there could be abdominal pain as well because you've just cut through those muscles in your abdominal wall.
Right.
So there's always risk for failure with these types of procedures. Sometimes the ties come off or they grow back together just from being cut. So we always try to push towards like the burning end of the tubal ligation just because it seems to be the most effective.
Right. Is there a way I could want to become pregnant after the procedure without having to reverse the tubal ligation?
So there is. There's always the option of in vitro fertilization, or IVF for short.
Okay.
And it's a process where the egg and the sperm is fertilized just in a lab. So the people in the lab will basically mix them together and they will come together and fertilize there. And then we take it and transfer it to your uterus, so it doesn't actually have to travel through your fallopian tubes into your uterus and meet the sperm.
Okay.
But it's just like pre-made basically, and it's inserted into your uterus, and it bypasses the fallopian tubes completely.
Oh, never heard of that. Anything done after the procedure, just I don't know, it just seems kind of risky to me.
And that's the normal feeling for everyone. Everybody feels like if it's not the natural way, then it's risky.
Right.
And there are risk factors, especially I would like to talk about with you being over 35. So you are 37, and there are risk factors and some complications that could happen that you have a higher risk for once you get over the age of 35. I just want to talk a little bit about those with you.
Okay. Thank you.
So there's always risk, and really in any pregnancy, for chromosomal abnormalities. But when you're over the age of 35, that risk seems to be heightened. And it could also lead to stillbirth or miscarriage. And that's always a very hard thing for a mom to go through, especially since you've had 9 children. You've been successful with your children.
Yeah.
So if a miscarriage happened, a lot of moms like blame themselves that they're just not working right anymore.
Right.
But it's really just the age. Everything just starts aging. It doesn't work as properly as it used to when you were young. But other complications are likely to happen, like gestational diabetes and high blood pressure during pregnancy. And then some complications that just make it necessary to deliver as a C-section. And that's obviously a more invasive procedure than just natural childbirth.
Yeah.
I've
actually never had a C-section. All 9 of my children were natural births, no epidural. Nothing.
You are a trooper. Because a lot of people come in and say that the epidural is like the best thing in the world.
Right.
So, also prematurity in the child and low birth weight for the newborn are likely. It also may take longer for you to get pregnant, just because there's a decrease in the quantity and the quality of your eggs. Like I said before, just with age, the eggs just get older, if you will. And it just makes it more difficult to be pregnant in the future.
Right. Okay. Well, thank you for sharing that information with me. I definitely didn't think about my age being a risk factor. Those risks definitely play a role in my decision making.
Yeah, and a lot of people don't realize that the age has a lot to do with some abnormalities, I guess you can call them. Also, the age of the dad can affect it too. So I don't know how old your husband is.
He's 6 months younger than me, so we're the same age.
Okay, so yeah, so that would put you even more at a higher risk than just you being over 35.
Right.
But you're welcome. But I would like to also share with you benefits of having the procedure performed. So since it permanently prevents pregnancy, you no longer need any type of birth control. It may decrease your risk of ovarian cancer, especially if the fallopian tubes are completely removed. Like I've said before, the procedure doesn't affect your menstrual cycle. Basically, you just don't ovulate. You don't release those eggs anymore. So the tubal ligation doesn't use hormones to prevent the pregnancy. It won't cause menopause or change your periods or mess with your natural hormones like other forms of birth control might.
I'm all for anything natural, so that's good. That's a plus for me.
Do you have any other questions or concerns?
I think you've helped me a great amount. I think I just need to discuss with my husband everything that you shared with me today, and see what our best option is. Our greatest concern was just me being sterile, complications that can arise from that, and if we were just 100% sure we were done having children. But I'm aware now that a reversal of this procedure would require major surgery, and I just don't think I'd want to undergo that. I also know that it won't change my hormones, mess with my menstrual cycle, or make me go into early menopause, which is an advantage to me because I was scared of something like that happening from being sterile.
Right.
I already have 9 children, and with the age we're at, I don't think we're also financially stable to have a 10th child, no double digits. And now you explained to me the risk of that I have for my age, so I believe I'm ready to have my tubes tied.
All right, so thank you for coming in today and for your questions. It's always good to be informed about a procedure before you undergo it. I can set up an appointment for you to discuss with your physician to schedule the procedure. Like always, you can call the office anytime if you have any other concerns or questions. As you leave, I can walk you to the front, and they can answer any questions about what insurance will or will not cover while you're here today.
All right. Well, thank you.
You're welcome.
Appreciate you.
I'll walk you to the front.